Hello guys, welcome back again. Yes, it's me Precious and did you miss me? Today we're going to be completing our series on postpartum depression. The last time we talked about ways we can prevent it. So today we're going to be talking about those who are already experiencing it and what they can do. So let's get right into the video. So from our last video, we established the point that we can take care of ourselves pre-delivery, during delivery, and post-delivery to make sure we do not break down with postpartum depression. And we also established the fact that in as much as we take precautions and do everything we should be doing, there's still a possibility that we could experience this because of the hormonal surge our body is going through. So today I'm going to be sharing some things that we can do if we're already experiencing postpartum depression. So hi, if you're watching me for the first time, if this is the first time of seeing my face coming to this channel, you're very welcome. My name is Precious, and on this place we bring forth wholesome content about growth, development, parenting, motherhood, and everything that you need to know in life on how to become the best of yourself. I know this is something you like, so please do like, subscribe, click on the notification bell, and stay tuned. So if you're a returning subscriber, very welcome back. Nice to see you again and hope you've been okay. So as we will be discussing today, postpartum depression, as we already established, can happen to anybody. It's not as a result of something that you're not doing. It's not as a result of your personality, or it's not your fault. That's what I'm trying to establish. It's just because there are so many hormonal surges going on at the same time in your system. So if you've already found out that you've broken down into a depressive state after having your baby, please do not panic more, because that is just going to worsen the situation. So the very first thing I would encourage you to do is to try to change your behavior. Try to get out more often. Most times it's not very easy to get out and about after delivery. You just want to get all the rest you can, but going out and getting a little walk post delivery can really improve your mood. It can really do a lot. And also engaging with so much playtime with baby. This can be very difficult, that it even hinders bonding with the baby. You might not even be able to feed the baby. You might not even be able to carry the baby if it's quite severe. At this point, you need a support system, like we said in the last video. You need someone to help you out with baby. You need someone to help you out with your daily chores. Try not to stay alone. This is the point where paternity leave comes to play. It's very important, because you need a support system, especially in that first 2 weeks, to pass through that phase. So please get someone to stay with you, to help you look after yourself and your baby. And also, please take regular washes, take regular baths. This can also help very well to improve your mood. Yes, please get some sugar into your system. I'm not saying take excess sugar, but try to eat something that is exciting. If you can cook, just try and order something you love to eat. Try your best to keep yourself up and about. Try your best to get back into your normal self. Try your best not to beat yourself about things you can't do yet. Make more researches. There are forums of new moms even online. I know that from antenatal visits, your midwife begin to give you booklets of forums of new moms, where you can share your experience of what you're having difficulty in, and someone that has gone through such experience will just tell you what to do and how to go about it and all that. So join such forums. Look out for there are also communities around. I know that there are also communities around in the neighborhood where new moms meet. Sometimes they meet weekly, sometimes they even meet more than once a week. Please do get into such communities, because when you find out that you are not going through this alone, some other people are still having these challenges, it's easier to solve. Because when someone is relating to what you're going through and saying, this is how I feel, It makes more sense. You know that it's not just you, and you're able to navigate through it. So please do get yourself some help. If you've tried all these and it's still not working, it's time to get involved with your medical practitioner. Talk to your midwife, talk to your GP, talk to your doctor. Please make sure that you get help. There are free help everywhere available for this period. Support also with baby. If you need any support with baby, even if you don't have any friends or families or anybody around, there are also health visitors, midwives, and people that can be assigned social workers. You must actually get support. Just ask for it. So do not feel like, oh my gosh, I'm going to expose myself, maybe my work, what would they think, how will my neighbors feel, what would they think. Nobody is going to think anything. Prioritize yourself. You're very much more important now, because we need you to be on a high spirit so that you can take care of your baby. So forget about what anybody is going to think, especially those of us that come from nationalities where these informations are not widespread. They don't even understand what you're going through. Please, just place yourself and your baby as a priority. Forget about what anybody would think, and just prioritize your mental health and your baby's well-being, because you need to be in a safe space to be able to take care of your baby. So please, if you've tried to improve your mood by eating, by exercising, by trying to get out, by trying to communicate with friends, and you're still overwhelmed, you're still not being able to handle it so much that is affecting your daily activities and breaking you down, please get medical help. Talk to your midwife, talk to your doctor. They'll be very, very happy to help. Nobody's gonna judge you. It's something that they themselves have probably gone through. So as a health practitioner myself, I've seen a lot of women struggle with this, trying to bottle it in. That is the worst. That's when it's going to cause more damage. So the last option, the very as in the point where it all ends, is the part where you have to involve your healthcare specialist, your doctor, your midwife. Talk to them. They will know how to direct you on how to get help, and make sure that you get the help. So please do not feel less of yourself. Do not feel like you're doing anything wrong. Don't feel like, oh my god, you're failing. You've not failed anything. You're just starting. Please hang in right there. We've all have been through that moment. Like I said, I couldn't even do much for the first 2 weeks. I was just all over the place until I started, talking to people, people that I used to see as high and mighty, and they were like, oh my gosh, no, you're better than me. I was worse off, and I was like, oh, it's not only me, and it's really helped me to pull along. I called my mom, whatever I was confused about. I made sure I asked her. If I didn't really want to blog her, I can call my midwife. It's better when you want to just trust your instincts. If you feel like something is not movie, just reach out, make a call. Nobody is going to bug you or be angry with you as a first-time mom for reaching out to ask for information on how to go about your health and your baby's health. No, please do not ever feel that you're bugging anybody or you're disturbing anybody. Please, as healthcare practitioners, we are very happy to help. So I'm talking from the perspective of a healthcare practitioner, and I'm also talking from the perspective of a mom. So we are very happy to help. Nobody is going to judge you, because we ourselves have gone through this, and we know that you need help to go through it, and we are there to help you. Now, as a mom, having had a tough time too in my first pregnancy, and having had to go through some of these too, the best thing that happened to me was getting help. That was the easiest solution. Speaking out, reaching out, telling my husband, oh no, this is how I'm feeling though, I don't know what's going on, I can't get a grip of myself. Talking to my mom, talking to my husband, allowing myself to be helped, allowing myself to be assisted, and making sure that I get the best help available. So these are little things you can do to make sure that because if you just keep locking it in and locking it in and locking it in, it's going to get to a point where you're not going to be able to do any daily activity at all. You're not going to be able to do anything. You're not going to be able to take care of a baby. You're not going to be able to get back to work. You're not going to be able to take care of yourself. So please, at this time, you are the priority. So please make sure you speak to someone. Make sure you get help. Make sure you do the best you can do, and You are going to be fine if you get help as soon as you can. So that is a wrap on the topic postpartum depression. If you have any questions, contributions, experience of how you got through yours, and you want to share with this community, because I tell you, you don't know who your experience is going to uphold, you don't know who your experience is going to give hope to, you don't know who your experience is going to lift up. Please feel free to share your experience in the comment section. Feel free to encourage people out there how you were able to go through your own stage and become better. And if you have questions, please feel free to ask your questions, and you don't know, the next person on the comment section might have an answer to your questions. So that is it for today on our video. I hope you loved what we talked about today. So what do you think we should talk about next? Suggest for us on the comment section. Till you see my face again, I am Precious. Please do like, subscribe, and share this video. Until I see you next time, please stay happy. Make sure you enjoy motherhood, make sure you enjoy womanhood, make sure you stay happy and live a very fulfilled life. Yes, you can. See you next time. Bye bye.